Welcome back to our channel, everyone. Today, we have a topic that's both common and bothersome. Conjunctivitis, also known as pink eye. Have you ever wondered why this eye infection occurs, what its different types are, and how it can be treated? Well, you've come to the right place. In this video, we'll explore the world of conjunctivitis, covering its causes, symptoms, and various treatment options. So, let's dive right in. Number 1. What is conjunctivitis? To begin our journey, let's first understand what conjunctivitis actually is. Conjunctivitis is an inflammation of the conjunctiva, which is the thin, transparent tissue that covers the white part of your eye and the inner surface of your eyelids. This condition can be caused by several factors, such as allergies, viruses, bacteria, or irritants. Number 2. Types of conjunctivitis. Conjunctivitis can be classified into different types, each with its own unique characteristics. The three main types are viral, bacterial, and allergic conjunctivitis. Let's explore each one in detail. Number 3. Viral conjunctivitis. Viral conjunctivitis is the most common type and is typically caused by a virus, such as the common cold or the flu. It's highly contagious and can spread easily through direct contact with an infected person or by touching contaminated surfaces. Symptoms of viral conjunctivitis include redness, watery discharge, and itching. It usually resolves on its own within 1 to 2 weeks. Number 4. Bacterial conjunctivitis. Bacterial conjunctivitis is caused by bacteria, such as Staphylococcus or Streptococcus. It can occur when bacteria enters the eye, usually through poor hygiene or contact with contaminated objects. Symptoms of bacterial conjunctivitis include redness, thick yellow or green discharge, and crusting of the eyelids. Antibiotic eye drops or ointments are often prescribed to treat this type of conjunctivitis. Number 5. Allergic conjunctivitis. Allergic conjunctivitis is triggered by an allergic reaction to substances like pollen, dust mites, or pet dander. It's not contagious and typically affects both eyes. Symptoms include redness, itching, and excessive tearing. Avoiding allergens and using antihistamine eye drops or oral medications can help alleviate the symptoms. Number 6. Other types of conjunctivitis. Apart from the main types mentioned earlier, there are a few other less common types of conjunctivitis worth mentioning. These include chemical conjunctivitis, which occurs when the eye comes into contact with irritants like chlorine in swimming pools, and giant papillary conjunctivitis, which is often caused by wearing contact lenses or an eye prosthesis. Number 7. Symptoms of conjunctivitis. Now that we know about the different types of conjunctivitis, let's talk about the common symptoms associated with this condition. The symptoms of conjunctivitis can vary depending on the type and underlying cause, but some general signs to watch out for include redness, itching or burning sensation, excessive tearing, a gritty feeling in the eye, swollen eyelids, and the presence of discharge, which can be watery, thick, or crusted. Number 8. How is conjunctivitis diagnosed? If you suspect you have conjunctivitis, it's important to consult with an eye care professional for an accurate diagnosis. They will examine your eyes, review your symptoms, and may take a sample of any discharge for laboratory testing. The diagnosis will help determine the most suitable treatment option for your specific case. Number 9. Treatment options for conjunctivitis. Let's move on to the treatment options available for conjunctivitis. The choice of treatment depends on the type and severity of conjunctivitis you have. Number 10. Self-care measures. For mild cases of conjunctivitis, self-care measures can often help alleviate the symptoms. These include applying warm compresses to the affected eye, using artificial tears to keep the eye lubricated, avoiding rubbing or touching the eyes, and practicing good hygiene, such as regularly washing your hands. Number 11. Medications for conjunctivitis. In more severe cases or when dealing with bacterial or allergic conjunctivitis, medications may be necessary. Antibiotic eye drops or ointments can be prescribed to treat bacterial conjunctivitis, while antihistamine eye drops or oral medications are commonly used for allergic conjunctivitis. Number 12. Prevention and hygiene practices. Prevention is always better than cure. To reduce the risk of conjunctivitis, it's important to follow good hygiene practices, such as washing your hands frequently, avoiding touching or rubbing your eyes, and not sharing personal items like towels or eye makeup with others. Number 13. When to seek medical attention. While most cases of conjunctivitis can be managed with self-care measures or over-the-counter treatments, there are certain situations when you should seek medical attention. These include experiencing severe pain in the eye, worsening symptoms, sensitivity to light, blurred vision, or if you have a weakened immune system. Number 14. Complications of conjunctivitis. Although conjunctivitis is usually a minor and self-limiting condition, complications can sometimes occur. These can include corneal inflammation, which can affect vision, or the spread of infection to other parts of the eye. Seeking timely medical care and following the prescribed treatment can help prevent these complications. Number 15. Tips for conjunctivitis relief. If you're currently dealing with conjunctivitis, here are a few tips to find relief. Avoid wearing contact lenses until your eyes have fully healed. Avoid exposure to irritants or allergens. Use cool compresses to soothe your eyes, and ensure you're following the prescribed treatment regimen. Conclusion. In conclusion, conjunctivitis is a common and often bothersome eye infection that can be caused by various factors. Understanding its different types, recognizing the symptoms, and knowing the appropriate treatment options are essential for managing this condition effectively. Remember to practice good hygiene, seek medical attention when necessary, and follow the advice of your healthcare provider. That's it for today's video, folks. We hope you found this comprehensive guide to conjunctivitis helpful. If you have any questions or experiences you'd like to share, please leave them in the comments below. Don't forget to like this video, subscribe to our channel, and hit the notification bell to stay updated on all our latest content. Thanks for watching, and we'll see you next time.